Ready?
Let's do this. I'm really excited to talk to you. I've been on high-dose steroids my whole life before I started Crenessity. Being on a high-dose steroids have really, it was really impacting my health. I got high blood pressure, type 2 diabetes, and all the weight gain and the mood changes with the high-dose steroids.
For 70 years, way before I started medical school, all we had to treat CAH with was steroids. And as you know, the steroids treat two things. First is to replace cortisol, since your adrenal glands can't make cortisol. And the second is to lower the excess androgen levels. Oftentimes in CAH, you need high doses to get the androgen levels low enough.
Well, that makes sense. So, Dr. Lin, I know Crenessity works differently from steroids. Can you explain to me a little bit more how it works?
So, Crenessity is, not a steroid. Crenessity will be able to decrease the androgen levels separate from the steroids. Crenessity binds to CRF type 1 receptors, and then that interferes with the binding of CRF to the receptors, and consequently, the decreasing the signal to the adrenal glands, and that leads to a decrease in ACTH and androgen levels.
That's really helpful. I've been on Crenessity for about 2.5 years. Taking Crenessity has lowered my androgens and decreased the amount of steroids I'm taking.
Crenessity could potentially let doctors treat patients like you with steroid levels that are lower than the high levels that were needed to be used for suppressing ACTH and androgens, possibly just at the level needed to just replace the missing cortisol.
It sounds like steroids help with my cortisol and Crenessity helps with my androgens.
That's absolutely right. After starting Crenessity, it's really important to be in close contact with your doctor and talk to your doctor about your symptoms and about how to go about reducing the steroids so that you can do it safely.
Thank you so much, Dr. Lin. This conversation has been really helpful for me.
Important safety information. Approved uses. Crenessity crinecerfont is a prescription medicine used together with glucocorticoids, steroids, to control androgen, testosterone-like hormone levels in adults and children 4 years of age and older with classic congenital adrenal hyperplasia, CAH. Important safety information. Do not take Crenessity if you are allergic to crinecerfont or any of the ingredients in Crenessity. Crenessity may cause serious side effects, including allergic reactions. Symptoms of an allergic reaction include tightness of the throat, trouble breathing or swallowing, swelling of the lips, tongue, or face, and rash. If you have an allergic reaction to Crenessity, get emergency medical help right away and stop taking Crenessity. Risk of sudden adrenal insufficiency or adrenal crisis with too little glucocorticoid steroid medicine. Sudden adrenal insufficiency or adrenal crisis can happen in people with congenital adrenal hyperplasia who are not taking enough glucocorticoid steroid medicine. You should continue taking your glucocorticoid steroid medicine during treatment with Crenessity. Certain conditions such as infection, severe injury, or shock may increase your risk for sudden adrenal insufficiency or adrenal crisis. Tell your healthcare provider if you get a severe injury, infection, illness, or have planned surgery during treatment. Your healthcare provider may need to change your dose of glucocorticoid steroid medicine. Before taking Crenessity, tell your healthcare provider about all of your medical conditions, including if you are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of Crenessity in adults include tiredness, headache, dizziness, joint pain, back pain, decreased appetite, and muscle pain. The most common side effects of Crenessity in children include headache, stomach pain, tiredness, nasal congestion, and nosebleeds. These are not all the possible side effects of Crenessity. Call your healthcare provider for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit MedWatch at www.fda.gov/MedWatch or call 1-800-FDA-1088. Dosage forms and strengths. Crinecerfont is available in 50 milligram and 100 milligram capsules and as an oral solution of 50 milligrams per milliliter. Please see the accompanying full prescribing information or find it at www.neurocrine.com/CrenecityPPI.